Can somebody tell me where did I leave my glasses?
Doctor, it's on your forehead.
Oh, it's on my forehead. Oh. This is actually scripted, but cognitive decline is not. Have you ever wondered what changes happen to our brain and our mind as we grow older? It's fascinating, yet very concerning. How our ability to remember things, solve problems, and make decisions can gradually change over time. Today, let's talk about something really important as we grow older. How our thinking and memory can change, which is medically termed as cognitive decline. It's not just about forgetting things, it can actually impact many parts of our lives. Knowing what causes these changes and how we can prevent and handle them is key to staying healthy and feeling our best. Hi everyone, my name is Dr. Sanjay Arora. My attempt is to help you unburden your health. The signs of cognitive decline can vary, but often include memory loss, difficulty with problem solving and planning, language problems, disorientation, decreased judgment, and changes in mood or behavior. These symptoms can gradually worsen over time and significantly affect daily life. Here, it is important to know the difference between forgetfulness, cognitive decline, and dementia. Cognitive decline can be simple, as occasionally forgetting where you placed your keys or struggling to remember a name. In contrast, dementia is much more serious. For example, someone with dementia might forget important details like home address or how to perform daily tasks, such as cooking a meal, using the phone, and these issues generally get worse over time. Cognitive decline and dementia are multifactorial, with causes ranging from genetic predispositions to lifestyle and environmental factors. While some causes are modifiable, such as lifestyle choices and management of health conditions, others, like genetic factors, are beyond individual control. However, understanding these causes can help in taking preventive measures, early detection, and appropriate management to reduce the risk or slow the progression of cognitive decline and dementia. Let me help you understand the progress of cognitive decline. Number one, as we grow older, it's natural to experience some degree of cognitive decline. This is part of the aging process and usually mild, and this is called normal cognitive aging. Next, it's called mild cognitive impairment. It is a step between normal aging on one side and the more serious dementia on the other. You might notice small memory or thinking problems like forgetting recent conversations. Did you give me that key? Or you might miss a scheduled appointment, but this condition normally does not disrupt your daily life. This may progress to dementia, it may remain stable, or even actually improve over time. This, unfortunately, can sometimes progress to the next 4 stages of dementia, of which the first is called the earliest stage of dementia, is a condition where mental abilities decline so much that it affects daily life. The symptoms include significant memory loss, confusion about time and place, difficulty in complex tasks like managing your finances, irritability, trouble with thinking and speaking, poor judgment, and changes in behavior. This is when cognitive decline becomes a more severe condition that affects daily life and independence, or what we call as ADLs, activities of daily living. The symptoms here include significant memory loss, even forgetting personal history, and not being able to recognize family members. When the dementia gets severe, this is when cognitive abilities are profoundly impaired, making the individual completely dependent. Here, the individual fails to recognize surroundings, inability to communicate coherently, and when there is complete dependence on the caregiver for all activities, you know that the person is in severe dementia. Unfortunately, there is also a decline in physical skills and loss of motor skills, and this unfortunately leads to infections due to physical immobility. The most extreme and the end stage of dementia is more of cognitive and physical decline, where the person loses the ability to interact and the person becomes frail, leading to a bed-bound status. There is also an inability to swallow, and the person requires 24/7 care. So are you wondering if dementia and Alzheimer's are actually the same thing? Well, Alzheimer's is the most common type of dementia, accounting for 60 to 80% of cases. It is characterized by accumulation of abnormal proteins in the brain, which leads to the death of neurons or the cells in the brain. This leads to loss of cognitive function. The early onset starts with familial Alzheimer's disease or FAD, which is a rare form of Alzheimer's that typically occurs before age 65 and has a strong genetic component. The sporadic Alzheimer's disease is a more common form of Alzheimer's, which typically occurs after age 65. It does not follow a clear pattern of inheritance, but genetic factors still play a role. Pathologically, besides Alzheimer's, there are various other types of dementia. Vascular dementia, which is the second most common type, which is caused by reduced blood flow to the brain and typically follows strokes or mini strokes, leading to impaired judgment and difficulty with planning and organization. Lewy body dementia is characterized by abnormal protein deposits in the brain, resulting in fluctuating cognitive abilities, visual hallucinations, tremors, and rigidity. Frontotemporal dementia involves progressive damage to the frontal or the temporal lobes, leading to significant changes in personality, behavior, and language, such as socially inappropriate actions or difficulty with speech. Mixed dementia is a combination of two or more types, most commonly Alzheimer's disease and vascular dementia, resulting in a blend of symptoms like memory loss and planning difficulties from the different dementias involved. A recent article from a leading newspaper discusses a new blood test for Alzheimer's disease that represents a significant advancement in diagnosing this condition. The key point about these new tests are that these tests for Alzheimer's aim to detect biomarkers associated through a simple blood sample, making the diagnostic process less invasive. Earlier, we had to test the cerebrospinal fluid or the fluid around the spine and the brain to find out the diagnosis of Alzheimer's. However, the biomarkers identified in these tests measure the level of amyloid beta plaques and tau tangles. Now, these are the proteins that get deposited in the brain, which is the root cause for Alzheimer's. Elevated levels of these proteins in the blood can suggest the presence of Alzheimer's disease. Now, let's break down and understand the various factors that actually contribute to cognitive decline. As I mentioned earlier, aging is a natural process. It's important to understand that severe cognitive decline is not part of aging. Cardiovascular issues like hypertension or high blood pressure can damage blood vessels in the brain over time, reducing blood flow and potentially leading to cognitive problems. Stroke, even minor ones, can cause immediate and sometimes long-term cognitive deficits. Atherosclerosis, which is the hardening and narrowing of arteries, can reduce blood flow to the brain, impacting its function. Lifestyle factors, like in all other conditions, include poor diet, especially ones which is rich in saturated fats and processed foods. These definitely negatively impact brain health. Lack of physical activity isn't just bad for your body, it's also bad for your brain too. Smoking and excessive alcohol use can both lead to brain damage and accelerate cognitive decline. Medical conditions like diabetes, especially when poorly controlled, can damage blood vessels and nerves, including those in the brain. Chronic inflammation, seen in conditions like rheumatoid arthritis or lupus, can affect brain functions over time. Sleep disorders like chronic insomnia or sleep apnea can significantly impair cognitive functions. Mental health issues like depression and anxiety aren't just mood disorders, they can also contribute to cognitive decline. They may even mimic or exacerbate symptoms of dementia. To effectively prevent and manage cognitive decline, it is crucial to address several key factors. A healthy diet and proper nutrition are equally important. Consuming a balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats, similar to what is called as a Mediterranean diet, supports brain health and mitigates risks associated with obesity. Also, the effects of hypertension and diabetes are controlled. Additionally, ensuring adequate intake of essential vitamins and minerals, particularly vitamin B12 and folate, is necessary to prevent nutritional deficiency that could lead to cognitive decline. Engaging in physical activity regularly, such as walking, swimming, or dancing, these physical activities improve blood flow to the brain. This promotes neurogenesis, which is the formation of new brain cells, and enhances overall cognitive function. Staying socially active, maintaining relationships, and participating in community activities can prevent social isolation, which is linked to cognitive decline. Engaging in mental stimulating activities such as solving puzzles, games, and lifelong learning, these all help build cognitive reserve and may delay the onset of dementia. How much time do you spend with your grandparents? What was the last game you played with them? Should they be playing games by themselves, or does it matter? Engaging them in board games can help with cognitive functions such as memory, communication, and emotional regulation. Word puzzles are a genre of game that focuses specifically on language. Some games like Scrabble focus on letter and word arrangement, while other games like crosswords focus on word recall. Jigsaw puzzles can range from simple puzzles that are easy to piece together to more complex puzzles that require a lot more hand-eye coordination and memory recall. Card games are great for practicing skills such as reasoning, problem solving, memory, and concentration. The same skills which are often in decline in individuals with dementia. Card games can either use a standard deck of cards like Rummy or cards that are specific to a game like Uno. Theory suggests that specifically designed brain training games may enhance cognitive functioning in older adults, especially in areas such as visual recognition, visual memory, and attention. Tetris on any platform and Candy Crush Saga on your mobile can be of great help. Finally, preventing head injuries through the use of helmets, seat belts, and other safety measures is crucial. Given our understanding of the symptoms and causes so far, let's look for some of the preventive strategies to help improve cognitive health and reduce the impact of cognitive decline. Therapies focused on improving specific cognitive functions and daily living skills can help individuals adapt and function more independently. Occupational therapy assists with adapting to cognitive changes and maintaining daily activities. Psychotherapy can help manage emotional challenges like depression or anxiety associated with cognitive decline. Remember, early detection is key. If you're concerned about cognitive decline, don't hesitate to speak with a healthcare professional. They can perform tests to assess your cognitive function and recommend appropriate interventions. In conclusion, forgetfulness is a common and generally acceptable aspect of human life. While cognitive decline is a complex issue influenced by various factors, many of which are within our control. It's normal to occasionally misplace items, struggle to recall names, or momentarily forget an appointment. These lapses are often benign and part of the brain's natural variability in processing and storing information. However, the extent to which forgetfulness is acceptable can vary. So next time, don't look at your grandparents and say they have lost their memory. Take time out, spend time with them. You could actually be the doctor to prevent their cognitive decline. If you're on a boys' trip and you forget to call your wife, well, that could be forgetfulness. But when you forget the name of your wife or you forget you have a wife, that is something serious. So until next time, stay healthy and stay well informed.